Hello and welcome to our comprehensive guide on a critical health topic, high blood pressure in seniors. As we age, our bodies undergo many changes, and one of the most common yet often overlooked health challenges is hypertension or high blood pressure, especially for those in their golden years. It's often called the silent killer because it can progress without noticeable symptoms, leading to severe health complications if left unchecked. But the good news is, understanding high blood pressure and actively managing it can significantly improve quality of life and longevity. In this in-depth video, we will explore everything you need to know, from understanding what high blood pressure is and why it's particularly prevalent in seniors, to recognizing its subtle signs, identifying key risk factors, and most importantly, discussing effective strategies for both home management and professional medical solutions. Our goal is to empower you with knowledge, practical tools, and the confidence to take charge of your health or support your loved ones. Let's begin this important journey together. To effectively manage high blood pressure, we first need to understand what it is and why it often behaves differently in seniors. Blood pressure is essentially the force of your blood pushing against the walls of your arteries as your heart pumps. It's measured with two numbers: the systolic pressure, the top number, which represents the pressure when your heart beats, and the diastolic pressure, the bottom number, which is the pressure when your heart rests between beats. For most adults, a healthy blood pressure is typically below 120/80 millimeters Hg. However, as we age, changes in our cardiovascular system can make us more susceptible to hypertension. The walls of our arteries naturally stiffen and lose some of their elasticity. This arterial stiffness can lead to an increase in systolic pressure, while diastolic pressure might remain stable or even decrease. This common phenomenon in seniors is called isolated systolic hypertension, where only the top number is elevated. And it's a significant concern because it's a strong predictor of heart attack and stroke in older adults. It's crucial for seniors to know that their target blood pressure numbers might be slightly adjusted by their doctor based on their overall health, but generally, maintaining readings below 130/80 millimeters mercury is often recommended for most older adults, sometimes even a bit higher for very frail individuals, to balance the benefits of lower pressure against potential risks like falls from overtreatment. Understanding these nuances is the first step towards personalized care. Regular monitoring, both at home and during doctor visits, helps track these changes and allows for timely intervention. Now that we understand what high blood pressure is, let's delve into the factors that cause it or increase its risk, especially in seniors. There are two main types of hypertension: primary or essential hypertension and secondary hypertension. Primary hypertension accounts for about 90 to 95% of all cases. For seniors, several non-modifiable risk factors play a significant role. Age itself is a primary factor. The older we get, the higher the likelihood of developing high blood pressure. Genetics also play a role. If your parents or close relatives had high blood pressure, your risk increases. Race and ethnicity are also factors, with certain groups, like African Americans, having a higher predisposition. However, many risk factors are modifiable, meaning we can do something about them. Lifestyle choices are paramount. A diet high in sodium, processed foods, and unhealthy fats can contribute significantly. Lack of physical activity and a sedentary lifestyle weaken the heart and blood vessels. Obesity or being overweight puts extra strain on the cardiovascular system. Excessive alcohol consumption and smoking directly damage blood vessel walls. Stress, especially chronic stress, can also temporarily elevate blood pressure and contribute to long-term hypertension. Beyond these, secondary hypertension, though less common, is crucial to identify, as it's caused by an underlying medical condition or medication. Common causes of secondary hypertension in seniors include kidney disease, thyroid disorders, sleep apnea, certain medications like NSAIDs, decongestants, or some antidepressants, and even adrenal gland problems. It's vital to discuss all your medications and health conditions with your doctor. as addressing the underlying cause can often help manage blood pressure more effectively. Understanding these causes allows for targeted prevention and management strategies. One of the most dangerous aspects of high blood pressure is its often silent nature. Many people, especially seniors, can have high blood pressure for years without experiencing any obvious symptoms. This is why it's crucial for regularly monitor blood pressure, even if you feel perfectly fine. However, in some cases, especially when blood pressure reaches dangerously high levels or when complications begin to develop, subtle signs might appear. For seniors, these can be easily mistaken for other age-related conditions or simply getting old. Look out for persistent headaches, especially in the morning, which are not typical for you. Dizziness or lightheadedness, particularly when standing up quickly, can also be a sign, increasing the risk of falls. Fatigue or confusion that seems out of the ordinary and changes in vision, such as blurred vision or double vision, should also raise a red flag. Nosebleeds, shortness of breath, or chest pain are more severe signs that require immediate medical attention. Ignoring these symptoms or dismissing them as part of aging can lead to severe and life-threatening complications. The long-term effects of uncontrolled high blood pressure are devastating. It significantly increases the risk of heart attack and stroke, which are leading causes of disability and death among seniors. It can damage your kidneys, leading to kidney failure, and impair vision, even causing blindness. High blood pressure is also a major risk factor for peripheral artery disease, which affects blood flow to your limbs and can contribute to cognitive decline, including vascular dementia. Given these serious risks, proactive management and regular checkups are not just recommended. They are absolutely essential for a healthy and independent life in your senior years. While medical intervention is often necessary, many effective strategies for managing high blood pressure start right at home with simple lifestyle changes. These home and lifestyle solutions are powerful tools in your health arsenal. First and foremost is diet. Adopt a heart-healthy eating plan like the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy, while significantly reducing sodium, saturated and trans fats, and added sugars. Aim for less than 2,300 milligrams of sodium per day, and ideally even lower, around 1,500 milligrams, especially if you have existing high blood pressure. Increase your intake of potassium-rich foods like bananas, spinach, and avocados, as potassium helps balance sodium levels. Next, physical activity is vital. Even moderate exercise can make a big difference. Aim for at least 30 minutes of moderate intensity activity most days of the week, such as brisk walking, swimming, cycling, or even gardening. Activities like Tai Chi or gentle yoga can also improve circulation and reduce stress. Always consult your doctor before starting any new exercise regimen. Maintaining a healthy weight is another critical factor. Losing even a small amount of weight can have a significant impact on your blood pressure. Stress management techniques are also invaluable. Chronic stress can elevate blood pressure. Incorporate relaxation practices, such as deep breathing exercises, meditation, spending time in nature, or engaging in hobbies you enjoy. Limiting alcohol intake to no more than 1 drink per day for women and 2 for men, and absolutely quitting smoking are non-negotiable for blood pressure control. Smoking severely damages blood vessels. Finally, regular home blood pressure monitoring empowers you to track your progress and provides valuable data for your doctor. Invest in a reliable cuff and measure your blood pressure at the same time each day, keeping a detailed log. These consistent efforts can lead to remarkable improvements. While lifestyle changes are fundamental, medical intervention often becomes necessary, especially for seniors, to effectively manage high blood pressure and prevent complications. It's crucial to work closely with your healthcare provider to develop a personalized treatment plan. When lifestyle modifications aren't enough to bring blood pressure down to a healthy range, your doctor may prescribe medication. There are several classes of blood pressure medications, and often a combination works best. Common types include diuretics, which help your body eliminate excess sodium and water, ACE inhibitors and angiotensin receptor blockers, ARBs, which relax blood vessels, calcium channel blockers, which relax blood vessels and slow heart rate, and beta blockers, which slow the heart rate and reduce the force of the heart's contractions. Your doctor will choose the most appropriate medication or combination based on your specific health profile, other medical conditions, and potential side effects. It's incredibly important to take your medications exactly as prescribed and not to stop taking them without consulting your doctor, even if you feel better. Abruptly stopping medication can lead to dangerous spikes in blood pressure. Regular follow-up appointments are vital to monitor your blood pressure, assess the effectiveness of your medication, and make any necessary adjustments. Your doctor will also consider any other coexisting conditions you might have, such as diabetes, high cholesterol, or kidney disease, as these can influence blood pressure management. Managing these conditions concurrently is essential for overall cardiovascular health. Don't hesitate to ask your doctor questions about your medication, potential side effects, or any concerns you have. Open communication is key to successful long-term management. Preventing high blood pressure, or at least delaying its onset and minimizing its severity, is always preferable to treating it. For seniors, and indeed for all ages, proactive prevention strategies are key to maintaining long-term cardiovascular health. The foundation of prevention lies in adopting and maintaining a heart-healthy lifestyle throughout your life. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, and low in sodium and unhealthy fats. Regular physical activity, even moderate levels, significantly reduces the risk. Maintaining a healthy weight, avoiding smoking, and limiting alcohol intake are also crucial preventive measures. For seniors who may already have some risk factors, or even pre-hypertension, these lifestyle choices become even more critical in preventing the condition from escalating. Regular health screenings and checkups are also indispensable. Don't wait for symptoms to appear. Schedule regular blood pressure checks with your doctor, even if you feel healthy. Early detection of elevated blood pressure allows for earlier intervention and can prevent it from progressing to full-blown hypertension and its associated complications. Educating yourself and your family members about the risks and preventive measures empowers everyone to make healthier choices and to support each other in maintaining good health. Remember, it's never too late to start making positive changes, and every small step counts towards a healthier future. We've covered a vast amount of crucial information today, from understanding the unique challenges of high blood pressure in seniors, to exploring its causes, recognizing its often subtle symptoms and severe complications, and finally, detailing both lifestyle and medical management strategies. The most important takeaway is this: high blood pressure, especially in older adults, is a serious condition that demands attention, but it is highly manageable. You are not alone in this journey, and you have powerful tools at your disposal. Remember the importance of regular monitoring, both at home and with your doctor. Embrace a heart-healthy lifestyle through diet, exercise, and stress management. Be diligent with your prescribed medications and never hesitate to communicate openly with your healthcare team about any concerns or changes. Your active participation in your health management is the most critical factor in preventing complications and ensuring a vibrant, healthy life in your senior years. We strongly encourage you to consult with your physician or healthcare provider to create a personalized plan that addresses your specific needs and health profile. Take control, stay informed, and live your best life. Thank you for joining us.